Hospitals and clinics across the country have reported constant shortages, with the Port Moresby General Hospital facing severe lack of basic medical drugs and supplies greatly affecting patient care, which has prompted professionals to speak out. Deputy Secretary Elva Lionel told NBC National News that a huge portion of funding can be allocated to health, but for procurement of these supplies, it's minimal. She says for this year, only 200 million kina was allocated for procurement, while they ideally need around 350 to 400 million kina.
Like this year's budget, we have 200 million, so we're going to try to see if government can top it out. Otherwise, that's the only money we can commit against. So basically our procurement is such that you have that budget, that's a limit to what you can procure, unless you go back to government and they can reallocate more, then we can procure more. So we will be limited by budgets as well.
Ms. Lionel also highlighted other key challenges that accompany procurement of medical drugs and consumables, like the present COVID-19 pandemic affecting shipping routes for delivery of foreign exchange and delivery in country like geography, among others.
There have to be enough foreign currency for us to purchase, to place our order. Then I think in the recent times where the COVID has affected international trade and all this, ships movement also affected that. So in the last 2 years, why we are now feeling the pinch, it's because of COVID also that affected the trade. So boats are not coming in because some countries have put embargoes there. So that affected also the medical supply procurement.
She also noted that drugs once procured also need to undergo independent testing again before being dispatched for use, requiring another 4 weeks for approval. The independent test laboratory in country presently only tests for all pharmaceuticals and chemistry testing. Stella Martin, NBC National News, Port Moresby.